Good morning, everyone, and welcome to today's meeting of the Audit and Performance Committee of the Perth Integration Joint Board. Today's meeting is one single agenda item, and that's to do with the audited annual accounts, the assurances, and finally getting them signed off. Can I first introduce the top table? I'm Councillor Sheila McCall, and I'm the chair of this committee. Twice to my left is Jackie Pepper, who's the Chief Officer of Perth and Kinross Health and Social Care Partnership. Next to me is Jessica Guild, who's clerk to this committee. To my right is Donna Mitchell, Chief Finance Officer of Perth and Kinross Health and Social Care Board and Partnership. And next to Jessica is Mark Grant, who is Finance Manager. And I also don't have Scott Henry here. Oh, Scott, you're online. Very welcome, Scott. I also would like to welcome Mary O'Connor and Rachel Brown from Audit Scotland, who will be talking to us later today and probably taking questions from you all. Can I ask the clerk to confirm if there are any apologies today?
Thank you, Chair. We have apologies from Bernie Campbell, and I note that Sandra Auld isn't with us, but I hadn't heard from her that she wasn't attending, so she might just be running late, but I'll let you know if she joins.
Thank you, Jessica. And can I remind those joining us virtually to use the chat box to attract my attention during the meeting? Thank you very much. And can I ask if there are any declarations of interest in respect of the business on the agenda today? Thank you. I don't see any raised hands. So we'll move on to item 3 on the agenda, which is the audited annual accounts for 2024-25. Can I ask Donna Mitchell, the Chief Finance Officer, to present the report? Donna.
Thank you, Chair. Good morning, everyone. I'm pleased to present a brief update on the governance assurance received from our partners this year. We have received formal assurance confirming that effective governance arrangements were in place throughout 24-25 for both NHS Tayside and Angus IJB, providing assurance of the effectiveness of their internal controls, including areas such as procurement and fraud. For Dundee IJB and Perth and Kinross Council, we expect formal assurance to follow shortly by the end of the calendar year, once their external audits conclude. In the meantime, both have provided positive indications through their internal audit and governance statements. Perth and Kinross IJB has fulfilled its own assurance commitments, providing confirmation of effective governance to our partners in line with our lead partner role for Tayside-wide delegated services. And as you're aware, regular assurance continues to be provided on clinical care and professional governance for services managed by the Health and Social Care Partnership, with clear mechanisms in place for supervision, improvement and feedback. Therefore, and in summary, the committee has received assurance from 2 partners and further confirmation is expected soon from the remaining 2. And we will provide an update to the committee on these as they come. So thank you. Any questions?
Any questions from Donna on this part of the paper?
When will we expect these assurances by the end of the year? Is there a specific time? Also, the assurance that we've given the second, is that going to be reciprocated?
Yeah, so we've provided our assurance, and what we expect is once their external audits are complete for Perth and Kinross Council and Dundee IJB, that we have formal assurance sent to us. But in the meantime, they have provided a level of assurance through their internal control process and through their own governance statements.
I don't see any other questions from the room. So we will move on to the recommendations of this part of the report, the assurances received from partners. The recommendations are: it is recommended that the Audit and Performance Committee note the assurance that has been received around the effectiveness of governance arrangements in NHS Tayside and Angus IJB, and note that assurance of effective governance arrangements in Dundee IJB and Perth and Kinross Council is expected by the end of the calendar year. Do the committee, or I can ask the committee if it can agree the recommendations in the report? Thank you very much. We'll now move on to the main part of the report, which is the annual accounts themselves. Can I ask Donna Mitchell, the Chief Financial Officer, to present the audited annual accounts? Thank you.
Thank you, Chair. I'm very pleased to bring this report to the committee today, and it presents the audited annual accounts for the financial year 24-25 and Audit Scotland's auditor's report. But before looking at the details of the reports and passing to Rachel Brown from Audit Scotland, I would like to take the opportunity to thank Audit Scotland for, again, your professionalism, advice and guidance throughout the audit process, and it's been very much appreciated by all of our team. I would also like to thank Phil Gerard and Chris Jolly for your work throughout the year to ensure that we have effective arrangements for governance and performance, and for your considerable involvement in the preparation of the management commentary and annual governance statements within the accounts. I would also like to thank the Health and Social Care Finance team. The team have again ensured strong financial governance and controls, and their work and efforts throughout the year has been very much appreciated. And that's thanks to Mark Grant and Callum Alsmeyer for again leading the annual accounts process this year. The work's been an excellent job, and we've worked well with both the audit team and the finance team in Perth and Kinross Council and NHS Tayside, and that's ensured that the IGB has been able to meet this date today. And I'd finally like to thank this committee and our IGB members for your challenge, your scrutiny and your support throughout the year. As contained in the cover paper to the accounts, the audit opinion stated the annual accounts of the IGB were free from material misstatement and that there were no significant findings or key audit matters to report. The audit report has provided one new recommendation that will supersede the prior year recommendation, and that is on and around sustainability. But I will now pass to Audit Scotland and to Rachel Brown to present the auditor's report. Thank you.
Thanks, Chair. I'll just give a brief overview of my annual audit report for the committee to consider before you approve the accounts for signing. This is the audit report on all the audit work for the 24-25 audit of Perth and Kinross Integration Joint Board. The bulk of our work is the audit of the financial statements, but we also, as public sector auditors in Scotland, cover and report on wider scope areas, which are financial management, financial sustainability, vision leadership and governance, and your use of resources to improve outcomes for the people of Perth and Kinross. And as a local government body for accounting purposes, you are also required to secure best value in your use of resources. So we provide a conclusion on that as well. So the scope of the audit set out in paragraph 5 of my report. My report also sets out my responsibilities as your appointed auditor. It sets out your responsibilities as the IGB and the committee's specific responsibilities for oversight of the financial reporting process. And it also confirms that I and my team remain independent of the IGB, so which is very important for the external audit role, to confirm that and not to provide any non-audit services to the body. So moving on to the substantive section on the audit of the annual accounts. The unaudited accounts rather that were submitted for audit were of a good standard, and the working papers that were submitted with them and the support we got from officers meant that the audit was quite straightforward. There are no matters relating to the misstatements or the quality of the annual accounts we want to bring to your attention. We do report on the materiality levels I have applied to consider any misstatements that might be identified. So that's given to Exhibit 1, and that's the threshold I use for requesting any amendment of misstatements should we find them, because we consider that materiality level to affect the economic decision making of those using the accounts for that purpose. We set out the significant risk of material misstatement that was identified to this committee in the annual audit plan earlier in the year, which is a presumed significant risk for all audits. So the possibility of fraud caused by management override of controls is a risk for all audits. You will see it in every one of my annual audit plans for every audit. We're not allowed to rebut that risk, so we have specific procedures that we carry out to address that risk. And as set out in Exhibit, let me get my numbers right, Exhibit 2, we set out the outcome of that, which is that we found no evidence of management override of control and no evidence of fraud. So that's a positive outcome in that regard. As Chief Finance Officer has said, I'm proposing a clean audit opinion, which hopefully you would expect every year, but it does give you positive assurance and public positive assurance about your use of public funds. in your strategic commissioning role. So that's not to be taken lightly, but it is a reflection of the quality of your financial management and your financial statements. I'll move on to the wider scope and best value sections. I've said all public sector bodies in Scotland receive my conclusion as your external auditor on these areas. We did identify a wider scope risk around financial sustainability. It's not unique to Perth and Kinross IGB. I see this at other IGBs and as a sector. What I see in Perth and Kinross IGB is playing out across the others in reduction of reserves, significant financial pressures, increasing demand, increasing complexity of demand. So I don't underestimate the challenge that you face in shifting the balance of care and redesigning services, working with partners. You'll note the recommendation that I make is very similar to last year's recommendation. Addressing financial sustainability will be a longer term thing for you to work with partners to move on. So last year we focused on the reduction of reserves. We've seen that play through in 24-25. You've pretty much exhausted the uncommitted general reserves that are available for contingencies. The reserves you do hold are earmarked for specific purposes, and you need to work with partners, the community, service users, carers and so on to redesign services. And I know I'm telling you things you already know, but there's an element of my report is in public to the public as well. So it has a dual audience in that regard. So it's very much recognising the challenge that the IJB is facing in that regard. So I've said that we've concluded your financial management is sound, but good financial management isn't enough to deliver financial sustainability. It needs that service transformation to play through, and the IJB can't do that alone. The IJB has a strategic commissioning role and is involved as a partner in discussions across Tayside and within Perth and Kinross specifically about changing services. Your own financial reporting sets out the challenges of your financial situation. So as far as I'm concerned, the IGB recognises the challenges ahead of it, has appropriate financial control arrangements in place, and it has a clear vision in terms of your strategic planning role, and driving that forward will be the challenge around how you deliver the best outcomes, how your role as an integration joint board then drives forward that across health and social care services in the area. So I didn't have any recommendations to make around the vision, leadership and governance. It's very much around the vision is around strategic planning, it's driving those through using your funds to make those changes. And your performance reporting, you meet the requirements to produce your annual performance report each year in July. And we've used that to conclude that your performance continues to be performing well against your comparators year on year. You compare against the Scottish average as well. I find your performance reporting quite clear in that regard, and there's a lot of information in that annual performance report, which I have not reproduced in my report. My hope is that people would be directed to your web pages and your own public performance reporting, but we're satisfied that your reporting in the public and to the IJB members is appropriate. And linked to that are conclusions on your arrangement to secure best value. We've concluded are appropriate and proportionate for the IJB. You've done the self-assessment, and off the back of that rotational approach to look at different best value characteristic or theme, called each year, I would consider appropriate. So that's a whistle-stop tour through the annual audit for 24-25 of the IJB. I'd like to thank officers and members for all the help we've done, and I'd like to thank the IJB for scheduling a special meeting so that this could, the accounts can be signed off by the end of September. I do appreciate that. So I'd like to say thank you very much. I have one question for the committee before I conclude, which is just to check before we sign the accounts later today, are there any matters related to fraud or non-compliance with laws or regulations that you've not already brought to my attention? Thanks very much, Chair. I'm happy to take questions, as is Mary, for any questions of detail. Thank you so much.
Thank you, Rachel, and the floor is now open to members of this committee if they wish to ask any questions from Rachel or Mary. Martin?
Thanks, Rachel. It's really just for clarification in my own tiny head here. Under indemnity insurance on page 43 or 77-98, there's no shared risk exposure. But if the IGB puts a direction to NHS Tayside, who would be subjected to that, Kinross, I could never say that word right, but you've also got two partners who are contributing to actually make that to make that a direction. So is there no a risk that NHS Tayside, if they get that have to take that risk, that the council are then exposed slightly because they're contributing as a shared partner? So if you're confused after that, you should live in this head for a while.
Thank you, Martin. Which one of you want to take that question? Rachel? Mary?
I will try and take it. I may draw in Donna on it while I find the right. Scroll down. Okay, this is in the accounts, so I will dredge up my knowledge of Kinross. So in terms of that, Kinross is for essentially health boards, NHS, insurance. So my understanding is that there would not be exposure for the council. I mean, when you as an IJB contribute and participate in Kinross, should somebody sue a party and be successful, the exposure is limited to £25,000. In terms of specifics for the IJB, I don't think anybody's been through that process yet for the IJB, but my understanding is it's very much focused on the NHS side. Donna, do you want to?
And I would probably ask Jackie just to confirm what I'm saying, but bringing it back to kind of simplistically, the IGB is setting the strategic plan and setting the direction of how they would envisage the objective to be met. They're then delegating that to the partners, to NHS Tayside, to Perth and Kinross Council to deliver that on their behalf. Therefore, the employees, the way the service is delivered is being delivered by Perth and Kinross Council and NHS Tayside. Therefore, we are reverting to their procedures in order for that to be carried out. Therefore, there's a risk. It goes back to the NHS Tayside insurance, etc., to carry that out. So the IGB is separate in that regard, is how I understand it. Is that? Did you agree, Jackie?
Yeah, I would share that understanding, and I'm just trying to think it through in terms of an example that might arise. And from a council's perspective, thinking that there may be a claim, for example, that may be raised through historical child abuse, or from an adult in relation to adult protection, or whatever that might mean. And I think it would be the council that would be responsible and liable in those situations. The IGB would not have any liability, in my understanding. So I think that would apply both from the health board perspective and for the council. So I suppose what you're saying, I'm just trying to think, Martin, are you asking that should the IGB make a direction about changing the direction, the configuration of services, and that resulted in some liability? I suppose it would be back to the local authority and NHS to deliver that in a way that meets national standards, individual and patient safety and statutory requirements. So I suppose it would be whatever could be delivered without breaching statutory responsibilities. So there's a reasonableness in there in terms of what the IGB can ask.
Excuse me a minute. Martin, are you happy with that answer? No. I think I was just very pleased that the officers on either side of me had the answer for you. I think I might have struggled myself. David, you're next, please.
Thank you, convener. Thanks for a very clear report. It's always nice to get external validation of our excellent finance team. We know they're excellent, but it's great to get an external view on that. So thank you for that. You've put in 2 recommendations. Given the landscape that we're in, financial landscape and the increasing elderly population, how optimistic are you that these can be effectively delivered?
I recognise it's a significant challenge and it's a significant national challenge. I know that my recommendations and the Accounts Commission and the Auditor General in looking at service reform, service transformation are recommending that public sector bodies work together to go down that route. It's not going to reduce demand. It's about making the best use of what you've got. So I can't guarantee that, you know, even redesigning services will mean there are fully financially sustainable services, because the population is aging, the complexity of their need is increasing. So I'm not going to say it's a magic solution that will solve it. I have confidence that services are being redesigned in conjunction with service users, with communities. We're seeing those changes here and widely across Scotland. It's not going to solve everything, but that's not a reason not to do it. Just because it's really difficult doesn't mean you can shy away from that. But it will lead to some difficult conversations for the IGB, for the partners, for other service providers with that. And that's a conversation for public services to have with the public about what can be achieved. So that's my view on it. So I will continue to recommend working with service users, working with partners, and so on. And the future will tell how successful that is going forward. And the more not intervention, that's the wrong word, preventative work that's done, and I know in Tayside there's some of that happening. That's a challenge to move away from the acute services towards the preventative, people taking responsibility for their own health where they can, and trying to reduce demand that way and keep people as able as they can be for as long as possible. That answers your question.
Thank you. I think, David, the only guarantee in life is death and taxes, to be honest. Not to be too bleak a viewpoint on it, so I think you give a very appropriate answer, so thank you very much. Heather, please.
Thanks very much, Chair. Thanks very much, Rachel, and your team for the work you've done, and to the team and the IGB for everything they've done. I think what I would say as a new member to this committee is that we've had regular financial updates, and I think that's really helpful, and that's made sure that we've been, you know, communicated with. So nothing in the report's a surprise, and I think, you know, what you've said is clear, and we understand the challenges that we have to face through transformation in order to achieve financial sustainability. But it's not easy, and we have lots of debates about it. But I think we have to be open and honest and say it's a challenge for everyone, every IGB, and certainly making that transformation of services is what we're about, but actually trying to do that with limited funds and no investments really difficult. So we will continue on that road, and as I said at the start, thank you to the finance team and to all the teams in IGB for all of the work they've done to help service transformation and to try and get to this positive position, because I think we could have been in a in a much more difficult position had it not been for the hard work of all the teams. I just wanted to clarify one thing. Rachel, you said that this would allow the accounts to be signed off for the end of September. I'm just wanting to clarify the discussion we had earlier about the assurance received from the other partners. Are we able to sign off the accounts without the assurance from the other partners? I just don't understand that bit because I've not been through this process before. So I just wanted to check. Thanks.
So that decision is for the committee to take. If they are comfortable with the assurances, they can, you can collectively agree to sign the accounts. As the external auditor of the two partners that are still being externally audited, I am content with the progress of those audits, that there's nothing there that would prevent me signing off the audit for the council. The audit work's almost complete. We're going through a review process, so there's nothing outstanding in that regard from my perspective that would prevent that, and there's nothing for Dundee City IGB so far. That's still in progress, but there's nothing coming out in terms of governance that would have any impact on the ability of this IGB to sign off. So I have no concerns from that perspective, although that's not coming through as a formal report for me, but just to say from my perspective, I'm comfortable with you agreeing to sign off the accounts.
Thank you, Rachel, and very good question. Heather, do you have a follow-up?
Sorry, just to say that I will take confidence from your contentedness.
Thank you. I don't see any questions in the chat box from our online participants, so I will move on to the recommendations of the report. It's recommended that the Audit and Performance Committee note the contents of Audit Scotland's annual audit report to Perth and Kinross IGB and the Controller of Audit on the 2024-25 audit, to approve the audited annual accounts for 2024-25 and to approve the letter of representation for signature by the Chief Finance Officer. Are we agreed to the recommendations? Thank you very much. The only thing that's really left for me to say is I want to add my thanks in particular to Audit Scotland, to the officers, but also to the members of this IGB, both voting or this IGB Audit and Performance Committee, both voting and non-voting members, for their attendance, for their due diligence, and for the very good questions that are raised at these meetings. I think it helps provide clarity and it helps to provide proper scrutiny of the work that's presented before us. So that's thank you to everybody who attends. The only last question I have is, does any member of the IGB Audit and Performance Committee require a private discussion? No, I see no need for that. Well, thank you very much. Well, that leaves me just to remind everyone that the date of our next meeting is Monday, the 20th of October at 10:30 a.m. And I thank you for your attendance, and I now close the meeting. Thank you.